about that, and I'm very curious to know if anyone does that's on the call and what their feelings or opinions are about that.
Alex, can I add something? Just a comment.
Sure.
Yeah, this is best me. And I have worked, I'm working with the WHO for the Maternal and Neonatal Health Department in Egypt. Yes, just with the tranexamic acid, actually, the WHO has included this as a promising drug in control of PPH in the package that they recommend in the third world countries to control PPH, because it's very cost effective, and there is a largest trial. I think, if I remember correctly, it was called the Women Maternal Antifibrinolytic Trial, which was WOMAN trial, that was published online in 2017. So this was the randomized, double-blinded, placebo-controlled trial that randomized women with the clinical diagnosis of PPH, and that was regardless of the mode of birth, to the regime of IV tranexamic acid or identical placebo. And I think nearly just over 200 hospitals. So they included all the high, middle, and low income countries. They all participated in that. So I think there were over 20,000 women in that. And they concluded that early use, so within 3 hours, so that was the time period of this IV tranexamic acid, it reduces maternal death due to bleeding in women with the clinical diagnosed PPH. And they said the early treatment appears to optimize the benefit. So as a result of that, globally WHO has included this as one of the drug in their PPH package that they recommend to control PPH. Yeah, that was just the comment.
Yeah, and I think thanks for weighing in, Bismin. I really appreciate it. And I think a lot of people are familiar with the findings of the women trial, and they're certainly very persuasive. The only thing I would probably sort of add to that is that obviously the indication for TXA was for treatment, so it was given after a PPH diagnosis had occurred in the cohort that were examined in the women trial. But I think what Anton was asking about is whether people are giving TXA prophylactically, so actually before delivery.
For the prevention.
Yeah, for the prevention as opposed to treatment. I know there may be some questions about treatment with TXA as well, but Anton, that's correct, right? You're asking us about prophylaxis rather than after a PPH has been diagnosed. That was the original question, right?
Correct. That is correct.
Okay.
Okay, sorry, I missed
No, I'm glad that we're talking, because obviously it's a hot topic right now. I don't know if there's a topic that's any hotter when it comes to PPH management.
Yeah.
I'm with you. I get questions about this all the time whenever I talk to folks about it. And I totally get that some people are very passionate about the findings or the interpretation of the findings of many of these trials, including the women trial, and other folks, may have differing opinions about that. So Bismin, you're right. The WHO does have this recommendation now for treatment, but I would imagine that the WHO is really thinking about things from a global standpoint. So that would include folks that deliver in the developing world, in addition to or as well as the developed world. So I guess one of the things that we wonder for folks that work in, well-resourced hospitals in well-developed countries where we have immediate availability of kit, equipment, and staff when PPH is diagnosed, whether that makes a difference really in terms of severe outcomes, certainly in terms of death, compared to, say, folks that work in a very rural setting in a place where they just don't have the luxury of the kit, staff, equipment, resources and the availability of blood that we otherwise do in many of the hospitals that we're based. There's actually there's an article that's being put together right now, and I know Ron put together something that was really good discussing this in the Canadian Journal. That's right, Ron. I think it came out in the last few months, where you talked about the potential utility of TXA in a number of settings, including obstetrics, correct?
This microphone button is very tricky.
I can hear you now, Ron.
Yeah, thanks. We just had the chance to publish a continuing professional development article in the Canadian Journal of Anesthesia, which included the use of TXA in various components of our anesthesia practices. One of them was obstetrics. Unfortunately, given the timing of publication and acceptance, we didn't have time to include the most recent Track 2 findings, which were interesting. The question about prophylactic, I agree that there doesn't seem to be much harm, but I'm just still very wary of the outcomes that have been measured in a number of these different trials and how clinically relevant they are. And I think one of the downsides that I have seen in practice is this assumption of the magic bullet of TXA stop this bleeding and failure to continue tried aspects and procedures to reduce postpartum hemorrhage.
Yeah, and I have to echo that. That's a super important observation to make, because in all of these studies, including the women trial, there was still bad outcomes, including deaths that occurred in those that actually were given TXA. If I'm right, in the women trial, it was a 1.5% risk of death, even in those that got TXA. So it's not zero. And I feel the same way exactly as Ron, that you can't assume that if you give TXA that you're done, there's nothing else that you need to do. And I do worry a little bit about people over-interpreting, the findings of a lot of these studies, assuming that they can give TXA and there's nothing else that's needed beyond that. It's an adjunct, and it's certainly not the only thing you need to do when you're called in to help for a patient that's actively bleeding, certainly in a scenario where the magnitude and the volume of blood loss and the rate of blood loss is high earlier on. So at Stanford, we're not using TXA prophylactically at all for all vaginal deliveries or cesarean sections yet. The other thing you guys may probably be interested in is that there's a new toolkit that's planning, that the CMQCC are planning for, official release. I think it's going to be probably later on this year, where this is going to be the discussion about using TXA and how to use it will be included in the toolkit. As I remember rightly, I don't think that they will be recommending that all women get TXA before vaginal or cesarean delivery either. So I think that for preventative use, I'm not sure there's enough evidence really to justify its use before delivery. And then after delivery, well, it really does depend on what your personal feelings are and what the group that you work within feels about the value of TXA. The other thing in terms of harm is from an anesthetic standpoint, there's been